Deep brain stimulation is giving people with Parkinson's disease a chance to reclaim their independence. Janelle Knight introduces us to a York County woman who had the procedure done a few months ago.
For years, Denise Holtzinger struggled with debilitating effects of Parkinson's disease. Simple tasks like walking or using her hands became nearly impossible as tremors overtook her body. But thanks to deep brain stimulation at WellSpan Health, Denise is getting her life back. Here's Denise's story.
My husband realized that I was shaking and had noticed, my right arm doing a little bit of shaking. And he said something to me and I said, I didn't even realize it at first.
Diagnosed with Parkinson's in 2015, Denise saw her career and quality of life steadily decline.
I was a manager at Walmart for 23 years. And it started progressing a little bit more when I was at work. Because at work it was heavy stuff that I did and stuff like that, and machinery. So I went to my supervisors and I told them, something's not right.
Eventually, Denise had to leave her beloved job at Walmart. She turned to her passion for floral arranging, but even that became impossible as her condition worsened.
I could not do my job anymore because my Parkinson's has increased. And with that, with the flowers, you have to cut the flowers. It was too hard, with the wires and stuff to try to cut them. So last year, I put up on Facebook that I was selling my business. Broke my heart because it's what I like to do.
We had gotten to a point where she was having a lot of trouble with her tremor and was having increasing trouble as well with her walking and ease of mobility due to the frequency of her medication usage, which had gotten to every 3 hours.
WellSpan Health neurologist Dr. Anthony May suggested deep brain stimulation, a procedure that places electrodes in specific areas of the brain to help control tremors and other Parkinson's symptoms. He referred her to WellSpan Health neurosurgeon Dr. Joel Weiner.
The stimulation affects the electrical output that is imbalanced. So because there isn't the chemicals that allow the tremor to be controlled, we stimulate the areas that are creating the tremor and reduce that motion. So it brings the patient back into balance.
These here are my incisions. This here is my transmitter type thing. This is what controls my tremors, is the radio frequencies that they send up here.
Just days after her February surgery, Denise was already experiencing improvements.
So we went up to Pinto Park just to, I kind of like the forest and I like the mountains. So we went up there and we didn't hike or the trails, we just walked along the waterfront there.
And to see her kind of walk in there, really no support needed, taking normal steps, not exhibiting her tremor, it was almost like night and day. It was rather dramatic. I would say more than average.
So who might benefit from this procedure? Doctors say various Parkinson's patients can qualify when medications aren't enough.
There's some degree of tremor that's not controlled, or they mostly have trouble with their medication wearing off, as I mentioned with Denise, or just unpredictably working. Sometimes the medication is working really well, but you have to use so much it causes a side effect.
It's a collaborative effort between patient, movement disorder neurology, neurosurgery, and all the teams and supports that help both the neurology and the neurosurgeon. So first is a diagnosis of a disease process that is amenable to deep brain stimulation therapy.
You have to fight Parkinson's yourself and get through it. And if you do, your outcome is wonderful. Because right now I'm not saying my best of life, I'm not the best yet, because I just had surgery February 25th, so I'm still kind of in my recovery mode and still got a lot of life ahead of me.
While Denise continues fine-tuning her treatment with regular checkups at WellSpan, she's focused on her ultimate goal: walking the sandy trail at Pine Grove Furnace State Park without stopping. It's a dream that seemed impossible before her surgery, but not anymore.